Mr. Cole.
Thank you, Mr. Chairman. It's good to see you again, Dr. Roubideaux. Always wonderful to have you here. And make a couple of comments quickly. I think a lot of the progress that has been made is because we've had continuity in your position. And it's meant a lot to not have the turnover, to have consistent, high-quality, ethical leadership. And I wish our guys in the Senate, or the people in the Senate, would understand the importance of that for the administration of the program. We've done a really wonderful job. I think the fact we've had these increases is really a reflection of this committee's bipartisan confidence in you, quite frankly, and commitment, as my good friend Ms. McCullough said, to the task at hand. On the sequestration, just for informational purposes, there was an assurance given by Chairman Ryan that this would not happen again. And I still sit on the Budget Committee. My two friends have been liberated. But we will make a commitment to you that we're going to make sure that that gets honored, so that Indian healthcare is held exempt if for some reason we fell into that situation again, which I know all of us would like to avoid. Couple of things, one specific request and then a couple of questions. Several years ago, you made for this committee a chart that literally listed, this is how many dollars Native Americans have on health care, this is how many dollars Medicare, federal prisoners, and it showed, of course, what we all know. But it was a very helpful tool, frankly, in both persuading our committee and people beyond our committee that, look, we have really fallen behind here. And while we've had 4 good years, I suspect that chart would still look discouragingly similar. So I would ask you if you could do something like that for us again. It's an extraordinarily helpful tool to have. I would like you to focus, give us an update on where we are in the joint venture program. Again, this has been a program where we've made a lot of progress, and it's been a program where we've been able to leverage a lot of money. So if you could, give us a quick update on what you're planning in that particular program going forward.
Well, thank you, and we will get you an updated chart on the per capita comparison of IHS expenditures per person versus other federal programs, and it does show the need and does show the disparity. With regards to the joint venture construction program, I appreciate your efforts and advocacy on that. Tribes have been wanting us to open up a new round of that, where because our healthcare facilities construction priority list still has about $2 billion to go to get through that. Tribes have graciously come forward and said we'd be willing to fund the construction if IHS could request the staffing. And so, as you know, many Oklahoma tribes have been very successful at that. We did open up a new round of joint venture construction program. We had 37 pre-applicants. We narrowed it down to 13 final applicants. We just selected 7 that will move forward sometime in the next few years, and we selected 3 to move forward this year, and I think you know that Cherokee and Choctaw are among those 3, so you get 66% of the ones who are moving forward this year from Oklahoma.
You didn't need to point that out.
But the tribes love this program, and you know we're mindful of the difficult situation you're all in with the budget context, and so we don't. Even though the tribes want us to approve more of these programs, we are mindful of the fact that it is challenging to get any increases through, and so we're trying to approve them to move forward at a rate that's consistent with how we've been doing it in the past. And hopefully we can time the congressional appropriations to the opening of these facilities, because we don't want to get ahead of ourselves and have facilities built but no staffing. So we would love to work closely with you on that timing and to see if there's any way to move more
Absolutely.
forward.
Well, as you know, we've had that problem actually in other facilities. My good friend Mr. Simpson here is focused on law enforcement a lot, where we've run into this problem, where we have built facilities but not provided adequate staffing. So thank you for being concerned with that. And thank you for this program. I mean, this is one this committee needs to realize has brought literally millions of extra dollars into the Indian healthcare system by tribes stepping up and helping. And most tribes that have the ability want to do. I mean, they're interested in doing Indian Healthcare Plus. They want to put additional resources, and this has been a great way to do that for a number of them. Last question, not to abuse my time. You mentioned in your opening remarks about self-governance, and while this is always a tribal choice as to whether they manage their health care, how it works out, and I respect that, I'm very pleased that you're putting an emphasis, because my experience has been where tribes take over more and more responsibility. Honestly, nobody looks after your own people like your own people, and nobody can be held accountable more easily than your own tribal legislature, your own folks, because they're right there, and you have immediate access to them. So can you tell us a little bit about what specifically you're doing to both strengthen tribal capacity in this area and to encourage more and more tribes to do this? And honestly, with the reassurance that it's not an effort to try and offload cost onto them, and I know there's a lot of skepticism and concern about that, as there should be in Indian country, but that's not the intent of this committee. It's to try and empower. And I would suspect, I know that's your intent as well.
Absolutely. We support the tribe's decision to choose what they want, and we have a responsibility if they want to stay with IHS and have us manage their programs, and we have the responsibility to help them as they move to managing their own programs. And there's no doubt that with some of the activities that we've had in the Indian Health Service over the past few years of trying to work more closely with both sets of tribes, trying to consult more, trying to provide opportunities. We have tribal management grant programs that tribes can apply for help if they're thinking about contracting. We do have self-governance resources for them as well. And certainly with contract support costs, the committee has really also honored tribal self-governance by fully funding contract support costs. That decision last year was really, tribes really love that. And we did too, because it solves that issue of being able to fund. But as you all know, the long-term solution is needed to prevent the adverse potential impact to the rest of the budget. And I think that's why we're proposing CSC as mandatory, and really want to talk with you about how we might be able to do that so it benefits all tribes. Because most importantly, I've heard from all tribes, the one self-governance, the one direct service, they want full contract support costs to support self-governance, but they don't want an impact on the direct service tribes or the services. And so I'm anxious to have those conversations with all of you.
I'm anxious to have them as well. As a rule, I think this committee is not usually in favor of making things that are discretionary mandatory. We've had too much of that, as Mr. Chairman said. On the other hand, this is a question of a level playing field. We've done this for every other group in this particular area, and not doing it for Native Americans, I think, raises some serious equity issues. So thank you for bringing it to our attention. I look forward to working with you on it. Yield back, Mr. Chairman.